Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Sharlee Dixon. Joining us today is Tracie Jade Jenkins, the Executive Director of the Boris Lawrence Henson Foundation. Established in 2018, the Boris L. Henson Foundation envisions a world where mental health in Black communities is prioritized through the development of culturally competent resources, programs, and education nationwide. The foundation's inception stems from a deeply personal journey of loss and frustration. Taraji P. Henson, alongside her closest confidant, Tracie Jade Jenkins, embarked on a poignant mission to honor the memory of Taraji's father, Boris Lawrence Henson. Boris, a Vietnam War veteran, grappled with untreated mental health issues upon his return, leaving an indelible mark on his family. Having witnessed the profound impact of Boris's struggles firsthand, Taraji and Tracie were compelled to take action. They recognized the stark absence of culturally relevant mental health support within the Black community and were determined to bridge this gap. Today, we have the privilege of delving into Tracie's journey, the transformative work of the Boris Lawrence Henson Foundation, and the ongoing quest to redefine mental health support within the Black community. Thank you so much for joining us today, Tracie. Welcome to the show.
Thank you so much for having me. I appreciate it.
Absolutely. So as we get started today, can you tell us about the mission and the goals of the Boris Lawrence Henson Foundation?
Sure. So we started back in 2018, and our vision and mission was to eradicate stigma around mental health in the Black community. And in some of the ways we are sort of moving towards that, as we all know, that's a big task to try and overcome. But we're looking at how we can remove some of the barriers to mental health, create a trust within the community around asking for and receiving services, and obviously providing those resources so that our community can actually access the services that they need. So that is our vision and mission. We are in year 6 as we speak, and we have gotten some traction. So we feel really good about the work we've done so far.
Well, congratulations on 6 years of this amazing work. I know that it is, like you mentioned, it's not something that is something you can do within a day or even 1 year. So to be able to be around for 6 years and be gaining some traction, I'm excited for you guys and this journey to help out in our community. So what really inspired the creation of the foundation and its focus on Black mental wellness?
Well, our founder, who is Taraji P. Henson, actually, she ran into some barriers in trying to find a therapist for herself and for her son. And as we went on the search and just did not run across many that were in the field and also who were available to give the services. And so, she figured, well, if she's having these problems and she has the resources to find what she was looking for, just thought about the many who are out there who are in need of services and may be challenged with the same thing. And so we started the organization with that in mind. But then again, once you do sort of provide an opportunity for folk to get the services, the stigma really, really, really holds us back. Yeah. And so, we broadened the reason why starting the organization to actually, again, knocking down some of that barriers to support for our community.
Right. And I can completely agree with you that it is difficult to find the provider that may be able to identify with you just based on, who you are, what you look like, how you present to the rest of the world. So while that's not, of course, everything in finding a provider that is the right fit, it definitely is a good start just to be able to find someone that understands.
Exactly. And to note that that person who understands may not look like you. And
True.
that's okay too. Also sort of pushed into that space of educating those who don't look like us, how they can sort of gain some cultural humility in the space, build trust with this community who for many years have been demonized for reaching out for help. And so You don't trust people who don't look like you. And we all know that we sort of work in groups, and our community is no different. But how we can sort of move through that space and just at least help those who are serving the Black community to have a little bit more of an understanding about the history and the context by which these services are being provided and offered. You can't fix what you don't know.
Right.
And so that's been a huge motivator for us to actually start our cultural humility program, which we may talk about a little bit later.
That we definitely will. That we will. But speaking of that, so July 1st marks the beginning of Minority Mental Health Awareness Month. It's a tribute designated by Congress in honor of renowned author and advocate, the late B.B. Moore Campbell, whose daughter battled bipolar disorder. Can you share with us why it's crucial to recognize the impact of race and ethnicity on mental health challenges and solutions?
Sure. We think of Black people in many different groups, the monolith. And there's so many different layers to minority groups. And again, we're only talking about one minority group, and that's the Black community, but there are women, there are people in the LGBTQ plus community, and all of these sort of intersections of being a minority or in a marginalized community. So it's important that we shed a light on the differences within our communities. One person sort of living a life in one zip code could have a totally different experience from someone who's living in a totally different, separate zip code with, different social impacts and structures, economic differences. So we want to shed a light on really regarding Black people and other minorities for their differences, exploring what that could be, what it looks like. How do you serve these different groups within a community, having the appropriate tools to actually serve them? And, it's an important month to bring some education around that. A lot of times, again, most communities are only looked at as having one journey. I don't even want to begin to crack the nut on the ancestral lineage, the epigenetics that lives in our bodies that are coming from all kinds of places that we don't even know about, right? We think about Africa as this, one country, but it's a continent. There are many countries there. And within those countries, there are tribes. And all of those experiences have been passed down for 7 generations. And that's a whole other piece that I think is missing in the care for African Americans and people in general, is really looking at their DNA expressions, the behaviors that are passed down from generation to generation. So we're hoping to widen that lens for people to see beyond what's standing in front of you.
And even taking that a step further, so how then are your programs designed to cultivate this type of awareness?
Well, we have things like Hangouts, for example, right? And so people, once again, are sort of used to moving in groups or in packs or in tribes, if you will. There's a lot of fracture that has happened in the Black community where there's not mom and dad, right? Some have been raised by the grandparent for so many different reasons. There's a sense that, they don't belong anywhere, right? We have created and designed our programming under the umbrella of meeting you where you are. And meeting you where you are has all kinds of opportunities for sort of a collective healing process where folk can come together and through activities that are familiar, right? Traditional activities like getting your hair cut, playing ball, game of spades. You can have conversations around mental health so that you're more comfortable, you feel grounded in that space. So we really look to go into the neighborhoods or other traditional spaces where Black people convene and offer these tools and services to them. And for example, we have something called wellness pods. We've already erected 4 on HBCU campuses where young people can come together, practice yoga, meditation, they get free therapy services. But again, the whole idea is to get them into an environment where they can feel a sense of belonging again. And we plan to do this around the country in other spaces, near community centers, retirement homes.
Yeah.
So yeah, that's how we are sort of speaking back to this fracture of family and sort of tribal unity in the communities.
Nice. I love the idea that it's not just an online type of thing. So I did look, of course, I looked at your website, on the foundation's website, and I, looked through the different types of programs. But I really like that you're bridging the gap, or like you said, fixing or mending the fractionality that has been created within the Black community. So you're going out into communities and reaching people exactly where they are. I am a social worker, so the idea of meeting people where they are is a social work tenet that has been, around for hundreds of years. So I really appreciate that. And I recognize that within the work. So, like I mentioned, I did peruse the website, and I saw not only are there programs to teach cultural humility to providers, but then there's also a search engine of sorts so that people are able to find providers. Can you talk to us about any other types of programs, or even, go in more detail about that cultural humility education?
Sure. I think you're speaking about our resource guide,
Yes.
which is an opportunity for folk to come online and look for a therapist. And those therapists, we require that they are coming in through a cultural humility lens. And so they're vetted, they're licensed, and, folk can choose which therapist works best for them. As we know, sometimes it takes a few rounds before you get it right, just like with any relationship. But we do offer that as a service to our community. We also offer our providers an opportunity to work with our programs. And so, for example, the wellness pods, we have our therapists and integrative wellness practitioners are all coming through this resource guide to serve the community directly. Our joy salons, where we offer psychoeducation or yoga or singing bowls while you're getting your hair done, right? So these kinds of things, we work with our community of practitioners as well as our community at large. So yeah, that's what that is. In the culture of humility training, we're actually rolling out a new program that is actually coming out this month,
Oh, nice.
where we're not only offering this service, this training, it's a 3-hour training. We're not only offering it to therapists, but we're also offering it to the community in general and educators. So all three of these different sectors, which covers everybody,
Mhm.
can take this training, and those who are therapists can actually receive CEU credits for that.
Oh, wow. Okay. Okay. How does someone access those types of trainings?
It will be on our website this month. We
Okay.
haven't launched this one yet. We revamped and we added the educators and general public sort of arms to it. So we've grown it and now expanded, and you will see the announcement that's coming up soon.
Nice. Because I was just gonna say I looked today and I did not see it. I'm leaving, I just left actually public education, and it is something that is definitely necessary. We're working with educators, some who've been around for decades, and some that are not, and you're from different parts of town, different
Yeah.
countries, different, states, different backgrounds. And so I do believe that cultural humility is something that is not, it's useful, but it's not necessarily something that is the focus of everyday trainings, or something that educators
Yeah.
receive on a daily basis.
Yeah. And it's not just training around the African American experience either. There's
Right.
one example, Dr. Kaya, who's leading this, she brought up an example where she talked about being in a therapy session with a Native American client. And, this client would not look in the eyes of the therapist. And, the therapist thought, well, hey, this is how we communicate. The eyes are the windows of the souls, and all of that. But in the Native American culture, at least this particular tribe, looking someone in the eyes is a show of disrespect. And so if you don't know that, though, because you're assuming, once again, all people respond to all things the same,
Mhm.
then, you're missing the opportunity to connect with this person in a way that they feel comfortable with. So it's also um, teaching people how to engage you, right?
Mm.
So community members need to know that they can say, this doesn't feel comfortable looking in your eyes, or my mom taught me this way of being, this is a sign of respect. And it differs across so many different sections that we really have to take our time to get to know how cultures move and then how we can interface with them in a respectful way that gives them a feeling of safety, dignity, and belonging.
Absolutely. So I'm one that definitely looking forward to that announcement about that further education, because I will share that with my colleagues, and so we can all continue in this work.
Beautiful.
Yes, ma'am. So you mentioned earlier that the foundation is doing some wellness pods within some HBCU communities. I heard joy salons. Can you tell me more about how the foundation is collaborating with other organizations or maybe even other professionals in the mental health field to further the objectives?
Sure. So currently we're working with Kate Spade, New York on the wellness pods that we have erected so far. And we have the three that are up now. One is Alabama State University, Hampton University, and the third pod is actually Bennett College. And we haven't announced our fourth yet, but all of those pods are supported by K State New York, who has a focus on mental health for girls and women globally. And so these particular pods are for the young women on the campuses. So we've been working with them for the past almost 3 years now there. Some of our other work that we're doing with joy salons and our hangouts is what I explained a little earlier.
Mhm.
We've worked with Just Heal Bro, for example, which is sort of a movement of Black men who are therapists or sports leaders who've been going around the country meeting with men, young men, to sort of talk about some of their challenges. And this is broad, it's not specific to Black men, but Black men are all sort of leading this. And so we've worked with them a few times with our hangouts. And of course, we have partners all across the country who are working through our resource guide, in which we send them into different spaces to do integrative wellness sessions, psychoeducation, et cetera. So to start counting the number of people we're working with, we will be here for a plenty long time.
That is awesome to hear, though, that there's such a large impact that it is, I'm sure it started small, but now it is growing and growing more every day. So again, congratulations on that level of growth. I know that it could not have been easy to do, but can we talk about how do you get around any barriers or obstacles that the foundation may have encountered to in these efforts to promote Black mental wellness, and how have you guys overcome them?
Interesting you should ask. As we all are aware, the DEI, which is obviously diversity, equity, and inclusion initiatives, a lot of them are sort of dying off because of some legislatures that's been happening and
Mhm.
a lot of rumblings in the space around it. And many nonprofits are being hit with this
Mhm.
because funding is being held off, or, people are a little tentative about supporting organizations who support specific groups. And so we've been doing a lot of work, just sort of looking at how we can come together, how nonprofits can come together to continue to service the community. As we know, the economy is not too stable right now. And so
Mhm.
even, small donations have begun to decrease, but that hasn't stopped us. And we've done a lot in terms of pulling together our strengths and working together to continue to offer these services. Again, whether you're serving LGBTQ plus community or women's groups, or even those who have special needs in our community are being hit by this. But I truly believe that together we can conquer anything. And we have been, and there are still some corporate leaders out there who are not afraid to walk into the fire. And so we've been blessed with that. And we're growing even more rapidly right now, which is interesting than we were before. because there's this, completely pulling back our services, especially in mental health, once you have gained the trust of somebody who says, yes, I want the help. Yes, I'm coming to you. It could take you a year or more to get that yes.
Mhm.
All of a sudden, you want to pull away your services, the support. Do you know how long it would take to build that trust again? And a lot of people do understand that and are willing to support that, our mission to keep forging ahead with any obstacles that come to bear.
We'll be right back after word from our sponsor.
Americans are increasingly concerned about mental health, with nearly 9 in 10 voters seeing it as a crisis. Mental Health First Aid provides crucial training to identify, understand, and respond to mental health and substance use challenges. Gain the skills and confidence to offer life-saving assistance. We offer courses for individuals, groups, and organizations of all sizes, including specialized training for veterans, law enforcement, EMS, and educators. Visit mentalhealthfirstaid.org or email hello@mentalhealthfirstaid.org to schedule your training and make a difference in your community.
Well,
Yeah.
I am glad to hear that even through economic struggles and things that are going on within the economy right now, that you guys have you been able to, shoulder that and keep pushing, keep moving forward. And something that I've heard you say multiple times is that the foundation's focus isn't necessarily just on, Black men or just Black women, but it seems to be much more inclusive of other cultures, other, minorities out there. So how does the foundation prioritize that level of accessibility and inclusivity in the services and the outreach efforts that you have going now and going forward?
Well, there's one thing we can say for sure is that the human experience is the human experience is the human experience,
Mhm.
especially in the mental health space. And so we do not turn away anybody who's willing to reach out and get some help. We've served folk from all those communities that I just named. We don't prioritize any particular community, meaning when we're choosing to accept an application for therapy, et cetera, it's not, oh, are you Black, white, or the third? You put your application and you're getting services if we can fund it. And so we continue to move in that vein. And we know that we all need each other, at the end of the day. And so if we can continue to find spaces where we can pull all of these communities into one space, we're stronger by supporting each other as opposed to dividing each other. Now, we do acknowledge that Black people in particular are the least likely group to reach out for help. And it's the least likely group to be able to afford. And so, our prioritizing, if you will, in terms of our reach, how do we get to the group that's least likely to come up and ask for help on their own? Black folk have been a priority in that space. And again, there's so many intersections in being a Black person, a woman, Black woman, coming from different groups, special needs, et cetera. It crosses the gamut. So, we serve the marginalized community. Black people are marginalized, and so are others. So we don't find ourselves in a situation where we are saying no to any particular group.
Nice, nice. And I really appreciate that as well. Being able to, yes, this is generally our focus, but being open to providing help and assistance to anyone. Like you said, the human experience is the human experience. So, can you discuss with me any notable success stories or even impactful outcomes from the foundation's programs? Is there a hallmark story of someone or a group of people that has impacted greatly?
Again, so many of those. We get so many DMs and, people celebrating their own victories with our help. I would say that we have seen obviously more people talking about this, which was our goal, right? Taraji, the day that she went out to Congress and she testified, that was back in 2019, hearing all of the voices coming out of the woodwork, ready to talk about it, ready to get help, was astronomical. So we saw a huge increase of folk that are willing to reach out for help, when before that moment, sadly, obviously, we didn't see so much of that. Even in when we first opened our free campaign, our therapy campaign, our system shut down in 24 hours.
Wow.
Like, it literally crashed. And again, that was after Taraji went out and sort of publicly declared her own challenges with mental health. And so, that was a defining moment for us. We then knew that at least people were now willing to get the help. And so we had to do everything that we could, and still are, to raise the funds and connect with other partners in order to provide those services. So, once that happened, we had over 1,000 men, Black men, who were on our waiting list. That was huge for us and still is. And, I think our greatest success so far, again, is that more people are talking about it now since we've been around.
Absolutely.
That was the goal.
Absolutely. And goal achieved, or in the process, that this the speech that you were mentioning, I actually heard a similar speech, or heard the same speech when Taraji Henson said it. And again, I'm in the mental health space already. So it was like, yes, somebody else is saying this. Like, it's not just us as providers who are saying it. Like, it is, it's not, it's everywhere. It affects everyone.
It is. And I think everybody was affected by that. I don't care what color you are, what background you come from. There's somebody in your household or one generation removed from you who is experiencing a mental health challenge.
Right.
And that was something we could all rally around.
Definitely.
And not to mention, COVID came right after that, right? Year. Again, our community was the most impacted through this. And so we feel like we were born for that time. And we did what we needed to do in that moment. And we're still serving folk who have been affected by COVID. A lot of people lost more community members, grandmom and, all they had. And we were there. And I think the community trusts us with that. This is why this DEI problem is not the thing that's going to shut us down. We have built this trust, and we're not willing to lose it over, finances or folk pushing against this work. And we really feel grateful to have been chosen for this work, both Taraji, myself, and my entire staff.
Absolutely. Well, thank you for hearing that call and answering it. It is definitely needed, not just within the Black community, but within lots of communities around. So in what ways would you say that foundation itself engages with and involves the Black community or the community at large in shaping the foundation's initiatives and strategies? So how do you guys find what's next? What you work on?
Well, we work very closely with our providers and therapists. We have an advisory council. And these are folk from all over the country, meaning therapists and research leaders who are working in the fields and literally, physically in the spaces where they're giving this care to community. And so we meet bi-monthly and we talk about what we've learned, what are some of the new trends? How do we address these new trends? Which is how we sort of came up with creating the Can We Talk conference that we did, and that is also a space where practitioners from all over the country, politicians, corporate leaders, we all come together and we look at, well, what did we learn from this past year? What is new? What are we not seeing in data? Because we also know that the research around African Americans in our struggles and our strife within the mental health space is not captured well. So we have to rely on having ears to the ground. And so Can We Talk has really been instrumental in helping us to stay connected with the community, as well as our advisory council. So we're always looking for more ways to bring people together for these discussions, but also to sort of invest in that sense of belonging. I can tell you that one of the top reasons that folk come to us for support, for therapy, is for loss of community. You would be surprised. You might think it's money or, they're having problems with this, that, or the third. It's loss of community. And coming out of COVID, there was a lot of loss that I don't think have appropriately acknowledged. So we're doing a walk that's coming up in October, where we are going to bring community members together from all over the globe who can participate in this walk, either in their own communities or virtually online with us. Again, another way for us to help people feel a sense of belonging again.
Absolutely. Thank you. And so then looking ahead, just like you mentioned, you have an advisory group and you guys meet and you discuss the goals. So what are the foundation's long-term goals or aspirations, especially in the realm of Black mental health advocacy and support?
Well, we haven't left our vision, mission, and goal, which is to see a decrease in the stigma around mental health. And for us, we have found that the more we bring people together in different spaces, again, meeting them where they are, that's been working for us. And so we have a big goal that we've been working through, our strategy with one of our partners, BET, that is a 1 million hour goal of joy hours, right? So 1 million hours of joy. And we've been, working on this for the past year. It's a 5-year goal. And so we're looking to give 1 million hours of joy. And so that is what we're looking to do, 250,000 hours per year. And we are on track to meet that goal. I think we're like 249,000, I believe, at this point. Okay. Don't quote me. You have to check that website, but we're tough.
So Tracie, you mentioned that you guys are putting on a joy walk on October 10th, which is World Mental Health Day. Can you give us some more details about that and talk to us about that a little more?
Sure. So we have this 1 million hours of joy challenge that we've been doing for the last year or so. And so a part of that is making sure that we sort of tap folk to get out, walk, tap into their joy. We're doing 72 minutes within this joy walk. The significance of the 72 minutes that we will be holding this walk in October, it really relates to the 72-hour holds, which is 72 hours. It's an involuntary psychiatric commitment for folk who are having a crisis that cannot extend beyond the 72 hours, right? So folk are released back into their worlds, but sometimes that 72 hours can be very painful for the folk who are experiencing that crisis and those family members who are having to sort of wait through that time frame. So we're turning that 72 hours into 72 minutes of joy. And we want to walk and also remember those folk who have experienced these 72 hours that we're talking about. Some have come through it and some have not. But this walk is all about changing the perspective to, a more joyful take on this moment, if you will, and honoring those people who have had this experience and those who may have it to come. How can we place that joy bubble around some of our crises and pain? So if you can commit 72 minutes, no matter where you are in the world, it could be on your treadmill. You could get a group of your friends together to walk in the park. Or if it's in your senior's home, you all can walk from the living room to the cafeteria to play bingo. I don't care what it is. As long as joy is attached to it and you're moving your bodies, you are a part of this global movement to push the energy of joy into the space when we most need it. So that's October 10th, World Mental Health Day. And we are so excited to get folk walking in their joy.
Nice. I like that. So thank you for something else to focus on positively. Joy is important for sure.
Yeah, please, more of it. It's a healing device that we often don't consider. We don't consider the actual physical science that's happening, right, biologically in our bodies when we are experiencing joy. We can have as many stress hormones as we want. There's plenty to go around. But having a moment of joy, to elicit that dopamine. And, we forget that the power of the body is greater um, than we give it credit for. So.
You mentioned as one of your larger goals or aspirations or things and activities that are coming up, the Can We Talk conference. It's happening May of 2025, right? Can you give us some more details about it? How can folks get into it? How can they visit? Give us some more details.
Sure. So our Can We Talk Symposium is our annual event that brings together, folk from the general public, political leaders, therapists, integrative wellness specialists. And we all come together for different panel discussions, joy activities, of course, looking to sort of figure out together what some of the trends are in mental health that we can support. We actually have opportunities for folk to do community service. We have an executive leadership track for therapists. We have a teens track because we know the importance of mental health for our young people. And so this happens May 2025. And folk can go to our website. You can register online. You can get the early bird special. All the information is there. It's going to take place in Prince George's County, Maryland. And we are very excited to come together once again to support and learn from each other with our Can We Talk Symposium.
Absolutely. So where can our listeners learn more about the Boris Lawrence Henson Foundation, and how can folks get involved and support?
Sure. Well, you can definitely go to borislhensonfoundation.org, which is our website. We're on Instagram, LinkedIn at BL Henson Foundation. You can find us. I even go to Google. You'll see many, many opportunities to read up about us, engage with some of the things that we're doing. You can certainly show up in October. October 10th is World Mental Health Day. And we want to get as many people to join us for this walk as we possibly can. So that'll go up on our website so people can sign up there for sure.
Nice. Well, I know that our listeners and myself will be spending a bit more time trying to find our hours of joy and making sure that we put those hours out there and hopefully participate in the walks and other things that the foundation has available. Thank you so much, Tracie, for spending some time talking with me.
Thank you. It was a pleasure speaking with you, and keep up that good work you're doing as a social worker. We appreciate you and we celebrate you too for that. So
Absolutely.
thank you.
Thank you very much. Thank you. And thank you to our listeners for taking the time to join us. The resources for this episode and an archive of all of our episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.